Rosanna, how are you?
I am well, thank you. How are you? Busy,
I
busy?
am well too.
Hoping it snows. That's what I'm hoping.
Oh, I know, that would be nice. My poor lawn and my trees.
Yeah, I'm worried about trees too. Hey, Monique.
Hi, Monique.
Hi, Rosanna. Hi, Renee.
Hi, how are you doing?
I'm doing good. Doing good. Hanging in there.
Looks like we all made it through Thanksgiving. That's good.
Yes.
And the awful Bronco game.
Okay, Renee, I'm waiting for Jan, but why don't we call the meeting to order, and if you could begin the roll call, please.
Of course. Representing Adams County on the Board of Health, Julie Mullica.
Present.
Rosanna Reyes,
Present and now audible.
Julie Shills,
Present.
representing Arapahoe County on the Board of Health, Jan Brainerd,
Present.
Dr. Thomas Faywell,
Present.
Dr. Kaya Gallagher,
Present.
and Tri-County Health Department leadership, Michelle Askenazi, Director of Emergency Preparedness, Response, and Communicable Disease Surveillance,
Present.
Heather Baumgartner, Director of Community Health Promotion,
Present.
Lisa Bolstad, Administrative Assistant, and I believe Lisa is unwell tonight. Let's see, Jill Bonchinsky, Director of Nutrition.
Present.
And I'm Renee Brockman, Executive Assistant. Monique Didier, Director of Administration and Finance.
Present.
Dr. John Douglas, Executive Director.
Present.
Maine Furman, Director of Human Resources.
Present.
Penny Grandy, Director of Nursing.
Present.
Brian Halabasek, Director of Environmental Health.
Present.
Jennifer Ledwig, Deputy Director.
Present.
Dr. Kelly Weidenbach, Director of Planning and Information Management.
She'll be on shortly.
Okay, and roll call is now complete.
Great, thank you. Just as a reminder to Board of Health members, please either use the chat function or raise your hand if you'd like to ask a question or make a comment. For those members of the public who are attending tonight, we encourage anyone who has questions to go to the Tri-County website, which has updated guidance documents as well as answers to frequently asked questions. The website also contains pages dedicated to topics like vaccine and testing and addresses issues that are specific to businesses and schools. If you can't find the information that you need, there are also Tri-County contact numbers listed on the website that you can use to call someone. During tonight's meeting, any members of the public who would like to make a comment addressed to the Board of Health can use the Q&A function on Zoom. After the meeting is over, I can assure you that all the comments will be compiled and shared with our Board of Health members. As our first action item, do I have a motion to approve the minutes from November 9th?
So moved.
Is there a second?
Second.
Any discussion? All in favor say aye.
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 Anyone opposed? Motion carries. As our next item, the board will review the Tri-County Health Department September 30th financial statements. Monique, will you walk us through this material, please?
Sure. Just trying to share my screen.
While she is pulling that up, Kaya, do you mind if I do a quick staff introduction?
Oh, no, sorry, I forgot. Are there any Tri-County team members that we should have introduced?
Fantastic, thanks. I'd like to introduce Dr. Maura Proser, who will be joining later to present on substance abuse data and programs, and Angelia Baker, whom I'm excited to introduce as a new member of the Community Health Promotion team. She joins us most recently from the University of Colorado. She's an Aurora resident and has an extensive background in youth protective factors and violence prevention. And I was going to turn it over to her for just a brief hello and a little bit about herself.
Thank you so much, Heather. And it is an honor and a privilege to be a part of the Tri-County Health team. I have just been here shortly 3 months now, and I can tell you I am excited about being a part of this team. Dr. Douglas, Mara, and definitely Heather. It's delighted that you chose me to be a part of this. I come from the University of Colorado Boulder. I worked for youth violence prevention for about 8 years. Prior to that, I worked for the Department of Human Services and Child Protective Services. I am a Aurora resident, and I am a community leader, an activist, and a mom. And so it is just great to be a part of Tri-County Health. I look forward for the things that we are going to do. And as I already said from day one, we are Tri-County strong, and we will overcome any obstacles that are set before us. So thank you for the time to introduce myself.
Welcome. Thank you. Michelle?
Great, thank you. I just wanted to introduce, I think we introduced him last time too, but just to let you know, since he's here as a panelist with Joshua Vine, who is our newest member as the Safety and Security Specialist for Tri-County Health Department.
Great. Thank you. Welcome. Have we figured out how to share the screen for Monique?
Yes, I got it now.
Okay, great.
Thank you.
Okay, you're on.
Can everyone see that executive summary?
Yes.
Thank you. So our September 2021 financial summary for the third quarter, our revenue, not including the budget used for fund balance, was under budget by 2.5 million, and our expenditures were also under budget by 1.8 million. Our net year to date through September was 5.6 million. In December of 2020, the Board of Health adopted our 2021 budget, and at that time it totaled 55.5 million. And in July and October of 2021, the board approved supplemental budget packages for 11.3 million and 1.9 million respectively. So now for 2021, our revised budget totals 68.7 million. The revenue through September 2021 totaled 47.6 million. Again, that's under budget by 2.5. And the significant variances that total includes is from the Program 520, our public health emergency preparedness, and our immunization and clinical response. The next graph, again, just shows us our 2021 revenue budget versus actual through September. Our expenditures through September totaled 40.4 million, and that's less than budget by 8.1. Those major expense variances, again, was the Program 520, our public health emergency preparedness, and multiple programs that expenses were reduced due to COVID response. And again, this graph shows our expense budget versus actual through September. Overall, our actual net income for the year to date is 4.1 million. And this net income includes the planned use of our fund balance. Again, these are our other graphs that shows our monthly revenues versus expenses and cumulative from January through September. Our other financial items are our portfolio. And for January through September, our 2021 earnings for our investments was only 22,000, and that's based on the fluctuation in the market. This just shows us again our programs and the numbers that are included in our executive summary. Any questions on our September financials?
I'm not, Dr. Faywell?
Can we go back to the first page? Is it just that my eyesight isn't as not, not the agenda, the first page of the report?
Sorry, I'm getting there.
Well, second line, budget under by 2.5, expenditures were under budget by 8.1. Am I reading that right?
Yes.
I thought it was 1.8, not 8.1.
Our expenditures are under budget by 8.1 million.
Okay, thank you.
Uh-huh.
Are there any other questions? If not, do I have a motion to approve the September 30th financial state? Oh, Rosanna, did you have a question?
My question was, this is a tremendous document, and so thank you for the staff that putting this together. But is there any way that we can receive this in a more timely fashion? Because you just cannot review a 300-page, such a big document, you know, to give it the due that it deserves in such a short time.
Jennifer, did you?
I'm assuming you're referring to the entire budget book, the entire budget book package.
Yes.
Yeah, we absolutely. And this is, so Monique will be presenting the highlights of the budget that we're asking you to present or adopt tonight. And apologies for not getting that out sooner. I think you have seen the proposed budget book. There have been some additional changes. We just pulling all of the material together. This month there were some last minute changes that we needed to go through. So apologies, and we will try to get those out to you more timely.
I appreciate that. Thank you. I know it's a tremendous task. Thank you.
Thank you. Before we move on to the budget book, we do actually need to have a motion to approve the September 30th financial statements. Do I have a motion to approve?
So moved.
Second.
Second. Any discussion? All in favor, please say aye.
Aye.
Aye. Anybody opposed? Okay, the motion carries for approval of the September 30th financial statements. So now we will open our public hearing regarding the 2022 proposed budget and appropriations resolution. So Monique, you have the floor again.
Thank you.
So we are going to present our 2022 proposed budget. Our budget planning assumptions for 2022, we have a per capita increase of 7 cents, which gives us 84,000 increase per capita, a market rate wage adjustment of 4%, anticipate a health benefit increase of 9%, our general fund operation budget increase of 3%. We are including COVID ELC funding of 15.8 million. We're also including the public health transformation infrastructure enhancement funding for 2.4 million. There is a para increase, a 0.5 para increase that's going to be effective as of July 1st, 2022. And our indirect rate for 2022 is 29.99%. The changes that are in our proposed budget from September that we presented. In September, we proposed a 63.7 million budget total for next year. And in December, we're proposing a 67.9 million. This increase is due to asking to utilize the federal pass-through grant and contract funds that have become available to TCHD since September. And that includes COVID immunization funding of 3 million, Adams County Nurse Home Visitor Program expansion of 1.2 million, and our Douglas County IGA of 438,000. Revenues for 2022, 67.9 million. And this just shows us the breakout of our total revenues for the year. Expenses are the same, 67.9 million. And it breaks out, of course, our major expense is always wages, but it breaks out how we have proposed to spend those funds for next year. This gives us a summary of our changes from our revised budget of 2021 and what we're proposing for 2022. Our per capita decrease of 2.5 million is due to the Douglas County exit. And then we have an increase, of our federal pass-through funds, again, COVID funds, and we're having a reduction of our fund balance use for 2022. Expenditures, budget changes, the summary of it from 2021 to 22. A decrease in contract for services. We're not anticipating those expenditures using as many expenditures, in 2022. And our capital equipment, we're spending 771,000 more than 2021. This pretty much is the same. It's just summarizing it and breaking it out for us based on different types of revenue. So we're going to be decreasing our revenue around 832,000 versus what we have at the moment for 2021 revised. The same for expenditures. We're decreasing our expenditures as revenues and expenditures must match. And so we're reducing our expenditures as well for 832,000. This shows our population change. The fiscal year 21 forecast we use from May 2020 and the 2022 forecast we're using from May 2021. These are the changes. Adams County, there's a reduction. There's a forecast of reduced population for 2022 of 2,399, and Arapahoe is an increase of 2,324, which net totals a decrease of 75. Our county budget increase, again, our per capita increase from 710 to 717, which would be a total of $84,000 increase for 2022. This chart again just shows our per capita increase starting from 2011 to what we're proposing for 2022. And that would be again $7.17. Our appropriation change for Adams County is going to be 20,000. Arapahoe County, we're proposing 64,000, giving us a total of the 84,000. Covered by our county general funds, our merit increase of 4%. We're asking for the adjustment, including which is the 16,417, and to cover the para adjustment for the 67,744, totaling the different, which is our total of 84,000. The TCHD budget adjustments, we're going to cover the 616,000 of our proposed merit increase, 4% merit increase for 2022. Excuse me, any questions?
Thank you, Monique. Thank you for your diligent work in terms of tracking up and down. It's just amazing month to month how much these numbers change. So thank you for your very careful and diligent work. Does anybody have any questions or comments? Okay, well, this is actually a public hearing. So Renee, has anybody signed up to make comments about this particular issue about the 2022 proposed budget?
Yes, currently we have 4 people who are signed up to speak. I am looking at the list of meeting attendees. It looks like only one of those individuals is currently here. I will go ahead and call on Matthew Southard, who has signed up to speak in on this topic.
Could you clarify, Renee, also that Matthew will only have 2 minutes to speak?
Yes, so Matthew, I'm going to go ahead and let's see, allow you to talk. And sorry, Monique, it's hard to see with the would you mind not screen sharing right now?
Sure.
That way I have a bigger view of the screen. Yes. Thank you.
Sorry about that.
So Matthew, you can go ahead and unmute your microphone. Please state your name, state the county that you are representing, and you have 2 minutes to speak.
Hi, my name is Matt Southard. I am in Adams County, and I have nothing for the budget per se. I just would like to remove the masks from schools.
Thank you, Matthew. We're not taking comment on masking or mask mandates tonight. Since you're not going to be commenting on the proposed budget, I am going to go ahead and put you back in the audience. Thank you for your comments.
Okay, just to clarify, Renee, are there any other members of the public that wanted to speak on the 2022 proposed budget?
Let's see, I have Erica Lopez. It looks like she is now here. Ms. Lopez, I'm going to go ahead and promote you to panelist so that you can address the board. Please be advised that you will have 2 minutes to speak. The board is only accepting public comment on the issue at hand, which is the proposed fiscal year 2022 budget for the board. We are not taking comments on any other subjects at this time. You may go ahead and unmute yourself, Ms. Lopez. State your name, state the county that you represent, and then you have 2 minutes to address the board on the issue at hand. And it looks like she has disappeared. So at this time, there is nobody else present who has signed up to speak on this issue.
Okay, thank you. So I'm going to entertain a motion. Once we have the motion on the floor, we can have further discussion before we take a vote. Do I have a motion to approve the 2022 proposed budget and appropriations resolution?
So moved.
So moved.
So that was Dr. Faywell, and then Julie, are you a second?
Sure, I'll second.
Okay, any discussion, any further questions for Monique? Not seeing anyone. All in favor, please say aye.
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 Anyone opposed? Okay, the motion carries. Thank you, Monique, and thank you, Jennifer. The next item on the agenda was going to be a report from the Board of Health Nominating Committee. And as the Board of Health began planning for 2022, we acknowledged that Tri-County is undergoing an organizational transition. And we also recognize that these changes necessitated consideration of some interim modifications in the bylaws, so that are now under consideration. The bylaw changes in turn influence the selection of the board officers for the upcoming year. So while our legal counsel is with us, we will now adjourn to executive session to hear his legal advice regarding the bylaw changes that are now being considered. And since we also had an executive session planned for the end of this meeting, I'm going to couple the discussion of the executive director's performance review into that executive session. Hopefully, it will take roughly 30 minutes for us to go into executive session, and then we will return to open meeting. So at this point, Sid, did you want to specify the legal provisions that allow us to meet in executive session?
Yes, Madam President, the executive session is pursuant to Colorado Revised Statutes, Section 24-6-402, parentheses 4, close parentheses, parentheses B, close the parentheses. And this requires an affirmative vote, two-thirds affirmative vote, which would be 4 votes required to go into executive session. And also because of the nature of the matter and the attorney-client privilege, we're going to ask that this not be a recorded session.
Thank you. So we need 4 votes to move into executive session. I will vote to move into executive session. We have other people. Julie Schills, Jan Brainerd, Julie Maleka. It looks like we have our 4 up, and we have Dr. Faywell as well. So looks like we'll move into executive session. I'll just mention that we're going to follow our confidentiality issues related to the performance review. So we'll have the legal counsel and then the Board of Health will meet by itself to consider the performance review results. So that said, I welcome people to join us back in open meeting. I apologize for doing this in the middle of the meeting, but our legal counsel was only available at this time. And so that's why we have to move out and come back. So, Ronnie.
So thank you. At this time, we would like to ask everybody except for the Board of Health members and Dr. Douglas to remain in the meeting, and Sid Overton, of course, as our legal counsel. We request that you remove yourself voluntarily. If I need to involuntarily remove you, unfortunately, you won't be able to rejoin the meeting. I have prepared an email in advance, so when our Board of Health comes out of executive session, I will go ahead and send an email to anybody who registered for this meeting by 4:20 p.m. today.
Hey, Renee, I'm sorry. Let me clarify. I presumably I should exit for the part of this that's reviewing my performance.
No. I said you should stay in. Absolutely.
Well, I guess maybe I'll just ask the board if they want me to do that. I'm happy to do it either way.
Oh, okay. I thought you were part of it. My apologies.
Why don't we go into executive session and then we can consider that question.
Okay, fair enough.
And Renee, I'm assuming you're stop the recording.
Yes. Hold on. I'm just trying to get everybody